best way to prevent drug addiction and overdose is to prevent people from abusing drugs in the first place. If they don't start, they won't have a problem. If they do start, it's awfully tough to get off. And I'm confident that by working with our healthcare and law enforcement experts, we will fight this deadly epidemic, and the United States will win.
The Trump administration is not the first to try to tackle drug addiction, but President Trump promises to be the last, insisting the United States will defeat the opioid epidemic. That would be a mammoth task. Opioids are a class of drugs which switch off pain receptors. They include prescription medication like morphine, oxycodone and fentanyl, as well as heroin. In 2015, so many opioids were prescribed, it was enough for every American to be medicated around the clock for 3 weeks. That's the finding from the president's own Commission on Combating Drug Addiction and the Opioid Crisis. It's found 142 Americans are dying each day from a drug overdose. And doctors' orders are part of the problem. The Commission's recommendation to start solving the problem is for Trump to declare a national emergency. That's something he hasn't done. Well, I'm joined now from Boston by one of the members of US President Donald Trump's Opioid Commission, Dr. Bertha Madras. She specializes in addiction biology at McLean Hospital in Massachusetts. And in Washington, we have Mike Vigil. He's a former agent with the Drug Enforcement Agency and now works on counter-narcotics programs at Mission Essential. Thank you to both of you for joining us on the program. Mike, let me start with you because you spent 30 years as a drug enforcement official. Give us the picture regarding the opioid epidemic. How is it affecting communities and families?
Well, the fact of the matter is that the opioid epidemic is probably the worst that we have ever suffered in the United States. And it's sweeping across the United States. We're looking at a multitude of pharmaceutical drugs. We're looking at illegal drugs such as heroin. And the primary issue is the prescriptions that are being given by qualified physicians here in the United States, but we also have illegal drugs that are coming from China. Some of them are coming from Mexico, and I'm talking specifically about fentanyl. And therefore, you know, it's a huge problem. You mentioned that it was a mammoth issue. I don't think that this is a problem that's going to go away, you know, in a tight, neatly wrapped package. It's going to take a long time, and it's going to take a lot of education.
Mike, you mentioned fentanyl. That's a synthetic opioid, isn't it? And those things are much stronger than other painkillers.
That is correct. Fentanyl is a synthetic opioid, and it's about 50 times stronger than heroin. It can be very lethal to an individual that doesn't, you know, have a lot of tolerance to that type of drug. And then there's carfentanil, which is a animal tranquilizer, and that's 1,000 times stronger than heroin. A few grains of carfentanil can be lethal to a human being.
Bertha, this is a massive problem, isn't it? Let's start with the basics. Why are these kind of painkillers being overprescribed by doctors?
It's a long story, but I'll try to go through it very quickly. In 1980, a letter to the editor was published in an esteemed journal saying that opioids given to hospitalized patients did not result in addiction, and therefore they're safe for administration. That catapulted a whole cascade of responses, including patient advocates, pain patients, pharmaceutical industries saying opioids are safe for chronic use, even though there was no evidence for their safety in chronic uses. What followed after that was that people began to pressure the Veterans Administration, pressure doctors to prescribe opioids. And then there was tremendous regulatory pressures on doctors who didn't attend to pain in their patients. By 1999,
who's to blame here? Is it the doctors? Is it the manufacturers? Is it the health industry? Who?
I think it's a sum of pain patients, doctors, pharmaceutical industry, regulatory bodies, government agencies. All of them have a role to have played in this.
We're being told that only 1 in 4 with an opioid problem is actually being treated. That's according to the National Survey of Drug Use and Health. Bertha, why is it so low? Is this a problem of insurance, or is there simply a lack of services?
I think that lack of services, lack of insurance is a small component of it. The real problem is that there is a large majority of people who are addicted to opioids who will not seek treatment and will not, in fact, don't even think they need treatment. So that we have to identify those people above all, because they represent the lion's share of people who are running into trouble with opioids.
Mike, so obviously there's a problem here with getting people to, in the first place, seek help for their addiction, and secondly, finding them somewhere to go to treat their addiction. How do we tackle those issues?
Well, the issue is one of education. You know, you're not going to force people to seek care, obviously, but I've always been a believer of demand reduction, and I agree with the doctor. It's a combination of factors that have led to this epidemic in the United States. It's over-marketing, aggressive marketing tactics by the pharmaceutical companies, over-prescribing by the physicians, and therefore you have a bubonic plague type of epidemic that, you know, is causing 142 deaths every day in the United States. So every 3 weeks, we suffer as many casualties as we suffered in the 9/11 terrorist attack.
Yeah, the figures are quite staggering. Bertha, President Trump makes the point that he wants to make a difference in preventing addiction in the first place, as well as improving treatment for addicted people. How do we go about preventing people becoming hooked on these painkillers?
I think there are 2 prongs to that response. One is to reduce supplies. If physicians reduce the number of prescriptions for pain, if physicians reduce the doses as well as the quantity, then we would have at least supply reduction on the part of prescription opioids. And that requires a lot of increased intense education. The other part of supply is reducing the heroin fentanyl supplies that are pouring into the country. We have to remember that most of the overdoses in the most affected states now are not due to prescription opioids. They are due to heroin and fentanyl in 2016 and the early data from 2017. So that the supply has to be reduced. Then we need a national campaign to prevent substance use across the board, because it is very clear that most people who use one drug use many drugs. People are not dying simply of heroin or fentanyl or prescription opioids. They have combinations of benzodiazepines and cocaine and other drugs in them. We have to literally denormalize substance use as a way of chemical coping in our society.
Mike, there is a drug that you can take to combat the effects of an overdose, Narcan, the anti-overdose drug. Do you think that should be made more widely available and easily accessible?
Absolutely. I think that, you know, first responders and, you know, communities should have access to Narcan, which, you know, reverses opioid overdoses. And it has been very effective in a lot of communities across the United States. So the answer is absolutely yes.
And Bertha, quick last question to you.
I would like to add to that.
Yes, go on, go ahead.
Just let me add to that. The problem is that if we simply distribute Narcan without having follow-up of people who've overdosed, we're not going to solve the problem, because many people are overdosing twice, 3 times, 4 times, and finally some of them succumb with an opioid overdose. If we do not have a system in place to offer them treatment on demand or offer medications assistance and detoxification on the spot, we are not going to address the real problem, which is how to get people who are overdosing into some form of treatment.
We'll leave it there, but thank you very much indeed for joining me, Dr. Bertha Madras and Mike Vigil.